Hello, happy Friday, happy Saturday, happy day of the week you're listening to this broadcast today. I'm very happy. I broadcast every Friday night at 7 p.m. Eastern Standard Time with a rerun every Saturday morning, 9:30 a.m. Eastern Standard Time uh, through Truth Be Told Radio Network. I am Dr. Rodrigo Rodriguez, and it's my real pleasure, my real privilege that I very much appreciate and thank you for it, to be able to communicate with you, to get to your living room, to your porch, to your car, wherever you happen to be listening to these broadcasts. Uh, Dr. Rodrigo Rodriguez, I'm medical director of BioCare Hospital. And BioCare Hospital is an institution that has devoted itself to find better ways to deal with healthcare. And in the process, because we began as a medical institution, I should say a normal medical institution, trying to help people with deadly diseases like cancer. Yet, very soon, I found out that after studying all those years, nobody told me all I had to do is write a prescription. And yeah, prescriptions I wrote, but I didn't get the results I wanted. And then you start rethinking. You have to go to the drawing board. What is what I'm missing? And then I found out that what we were missing was care. Care, if you go to the dictionary, is a very proactive verb. Care means that I have to stand up, get out of my comfort area, and start doing things for myself. I have to become aware of where am I. I have to be careful. I have to be watchful. I have to be a good provider. I have to be responsible for my acts, because I want that this body that has been entrusted to me works the best possible. If I don't do that, if I don't help the body to do what the body knows how to do, then prescriptions are only going to go so far. I'm going to give you a very simple example. You get a sore throat. You go to the doctor, and the doctor writes a prescription for the sore throat. You go to the pharmacy, you get your antibiotic, you take it, everything is clear in 48 hours. Perfect. Couldn't be perfect. Couldn't be better. I just corrected the disease with one pharmaceutical product. Think again. Really think again. Was it really the prescription antibiotic that cured me? Or was it God's hand working through nature, immunity, and so on? I think the second is the truth. Because what happens is when the doctor gave you that antibiotic and you started taking it, the antibiotic has, of course, a deleterious effect on the bacteria. The bacteria is going to be weakened, is going to lose strength, and that is the little gap, the little advantage that your body has to come in, zero in, and finish the job. Not only that, but the antibiotic is going to kill the bacteria, but it's not going to heal you back. Bacteria, infection, inflammation, all the things that come with it produce damage. They hurt your tissues. They hurt your organs. Well, the antibiotic probably dealt with the bacteria, but what happened with all the aftermath? What happened with all the other effects? What happened with all the side casualties? Well, that's where your body comes in, and then is when healing is produced. You remove all the debris, you remove all the toxics, and then you start replacing dead cells for good, new, brand new cells, and you start recuperating yourself. And few days later, you even forget you had a problem. You're talking to friends, you say, oh, last week, yes, I went to the beach. And they say, no, last week, remember, you had your sore throat. You couldn't go out. Oh, yeah, you're right. It was the week before. In other words, you even forget. We forget about it because we did so well. So was the prescription or was everything you have to offer? And one thing brought me to the next. And the next is another very important discovery. As we started implementing good things for people to improve, to support that healing, to support that body, to support that immunity, we started discovering that we were treating a cancer patient. But then the cancer patient told us, you know what, doctor? Now I don't have to take this much of this because my diabetes is better. You know, doctor, I've been losing weight and I feel stronger. You know, doctor, my blood pressure works better. And my heart problems seem to be going away, at least diminishing in intensity. So you start wondering, is it that when I help one problem, I'm actually helping many others? And the answer is an absolute yes, particularly when we're talking about chronic degenerative inflammatory diseases, which is what affects us all. We have more and more of these problems. Numbers are staggering. We see really critical figures on how many people with diabetes and high blood pressure and heart disease and strokes and Alzheimer's and cancer, etc., are around. All you have to do is get out of your living room and ask people you know, ask people at work, ask people at the church, ask in your family. And we're going to see that we see more and more people with these diseases. Numbers tells me that 7 out of 10 people are going to die of one of these problems. So why are we being affected by similar diseases, at least in urgent? Because, of course, a heart attack looks very different than a kidney failure, than a lung disease with chronic lack of oxygen and oxygenation, than a diabetes. They seem to be very far apart. Cancer, they don't seem too much connected, but they are. They are because they originate in metabolic disturbances produced by poor lifestyles, by poor food choices, by sedentarism, by toxics in the environment and the food, by things we shouldn't do that we do. All those contribute to this scenario. And when we start cleaning all those things, a lot of good things will happen. It's like when you mow your lawn and clean your garden, all of a sudden you might see that cockroaches and other plagues disappear. Why? Because they don't like cleanliness. In a clean house, you don't have those problems. You have a dirty house, you're going to have cockroaches, you're going to have rats, you're going to have ants, you name it. It's not a matter of using a pesticide. It's a matter of keeping places clean. The same is the body. If we can keep our bodies clean, if we can keep our bodies in good shape, if we can pay attention to them, if we care, remember this word, if we care for who we are and what we have and how we perform, we can start making a big difference. So putting all these things together is what created BioCare Hospital. We start with a hospital where you want to see patients, when you want to help people, but then you go on beyond that. Because a hospital is a place where people should be nourished. Yet hospital food is, I don't have to tell you, I mean, next to airplane food, now there is not even airplane food anymore, but used to be the perfect combination of bad food, bad choices, bad ingredients. So how can you heal if you have that? So we decided we needed a hospital where food and cooking and all these things were under control, and cleanliness and cleansing and detoxification and oxygenation, hyperbaric oxygen, you name it. We needed a place where we could do this for each one of our patients. And as we went on and on, we were discovering that we were not only helping the cancer, that we were not only helping this person with diabetes, that we were not only helping these people that have some mental problems, we were helping other things as well. And over the years, we started in 1976, so it's been quite a long time. And over the years, we were discovering that yes, when you help one of these chronic inflammatory conditions, you help them all of them. There's not one that will not be positively affected by good changes in our lifestyles, in our supplementation, by our food choices, etc. So that is why it is so important to talk about this. And I'm going to talk in the next segments of a problem that affects many, many people. Numbers tells us that 40% of the population, 4 in every 10 people are affected by high blood pressure. But that's when you have the diagnosis. That is when you know you are hypertensive. Those numbers are when you know, yes, I have high blood pressure. But what happens with all the people walking around that they don't even know? What about with the people that they might go to the doctor, they look okay, but when they leave the place, they have peaks of high blood pressure and so on. If you put them all together, you're talking about of 60% or more than half of every adult in America has a pressure problem. So don't go anywhere. This is very important for me. This is very important for you. My dear friends, I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And today we're talking about BioCare, of helping our own bodies to be healthy and keeping diseases away. That is that simple, the subject that we are covering today. And believe me, I'm not telling you any false promise. This is absolutely true. And you're listening to us through the courtesy of Truth Be Told Radio Network. Remember that we broadcast every Friday night at 7 p.m. Eastern Standard Time, but we repeat the same program every Saturday morning at 9:30 Eastern Standard Time. But you can go to Spotify and search Truth Be Told Radio Network, and you're going to have over 150 hours. But you can also go to the social media of your choice. And these videos, the broadcasts, you can watch them on Facebook, on Twitter, and Twitch, YouTube, you name it. And you can also contact us through, again, the social media of your choice. In this world that I'm still having problems to understand, it seems that communication is very much ongoing everywhere, and it is even difficult to find a place to hide anymore. Everybody knows who you are, what you do, etc. So by saying this, what I say is take advantage of the resources, of the information that you can get for yourself to care for yourself. because taking care of yourself can go a long way. And I was telling you that when we began the hospital, we were trying to treat deadly diseases with everything we believed in, with a lot of support to the body. And we were pleasantly surprised to see that many times by helping cancer, we were helping also the diabetes or the high blood pressure or something else. And as years have evolved, we have understood more and more that, of course, all these chronic inflammatory diseases have a common origin. Because you might say, oh, doctor, why can't you say that if you treat cancer, my diabetes is going to get better? Because at the bottom line, at the foundation, at the origin of all these diseases, inflammation is at the bottom of all of them. And inflammation is a normal reaction of the body. It is actually a defense mechanism. If we didn't have inflammatory processes, we would be dead because they help us to get out of emergencies. When you have a car accident, when you have any sort of disease, when you have a flu, it is inflammation that comes to the rescue, that brings more blood, that brings a lot of inflammatory cells, which are immune cells. So it helps to beat the problem. Then that same inflammation, through a higher blood output, will produce a better cleansing and detox and leaving the place ready for new cells to nest, for new cells to replace everything, and then healing happens. And that is exactly why inflammation is important. But what happens if, for any unknown reason, you have a little trickle of inflammation going on? Little bit, every day, 24 hours, 7 days a week. What happens? That constant problem with inflammation is going to turn into a more serious problem, because it's going to be producing antibodies, it's going to be producing antibodies that you don't need, it's going to be producing inflammation of cells that you don't need, that are going nowhere, etc. And you say, but why am I getting that trickle of inflammation all the time? It's like a house. You have a house, but you have a faucet dripping. Tick, tick, tick. Not only the noise is annoying, but you're throwing down the drain water you need for something else. Or you have a little something that's plugged, that's just using electricity for nothing. You're wasting. That's what happens with the body. And that happens when we get into the body substances that can trigger inflammation at a very low degree. The worst of them all, refined sugar. And sugar we love. It is very important that we get in our heads that we don't need that sugar. I always tell people, before you eat, before you put something in your mouth, think, why am I eating this for? Just for the pleasure of it? That's not valid. That would be as if I tell a drug addict, why do you cocaine? And he'll tell me, oh, because it's very pleasurable. And I'm sure he feels very good with it. But you know the final consequence? So no, I would not do it. I would not dare to bring that substance to my body. Why do I do sugar, refined sugar, if I know it's producing constant chronic inflammation? Then I eat bad fats. What is a bad fat? A fat that comes from a factory, which is vegetable oils. They produce inflammation, but we love our fried food. and we really have bad choices. You know, I'm a total proponent of the use of olive oil. And people ask me very frequently, doctor, but they say that olive oil is not very good for frying. And my answer is always the same. Fried food is not for humans. So no, you don't need a frying oil. What you need is do not eat fried food. I mean, Orientals do a lot of frying, but it's so fast. They use this wok at a very high temperature. They just kind of move the thing around and they put it on your plate. That's not really frying. But in America, we love deep frying. We really put the thing and we drown it in very high temperature oil. That's not good for you, believe me. So we start to be making a lot of changes. And once again, if you go to the websites, to many places, you're going to find a lot of resources. BioCare Hospital has a lot of nutritional resources, but you can find so many recipes, so many good ideas of what to do, which are fast, are simple. Because another common comment is when people tell me, but doctor, I don't have the time. If you don't have the time to think of what you need to give your body as nourishment, if you don't have the time to plan good food for the body, if you don't have the time to do any of those things, you're going to be sick. And this morning, I was talking to a patient. Once again, I'm a doctor. I see patients every day. And I told him a long time ago that we should do this, we should do that. And the problem with these people, and the problem many times with any of us, is this nonchalant attitude. Oh yeah, I know. I'm going to, I will plan, that type of thing. Yeah, it's like I want to shut you up, you see. Because if you don't have critical symptoms, you think you're not sick. And that's what we're talking about. Well, now this person is very sick. Now this person cannot do a lot of things. And medicine can no longer help him to the extent that he would like. And he told me this morning, doctor, I'll do anything you tell me, but get me back to where I was. A little bit too late. So we have to think of all those things because you want to be in good shape. You want to be in good shape. And what happened is, I was telling you, by trying to take good care of people in the way we thought it was good, we discovered that we could help many diseases, and then we now know that we can prevent all those diseases. And we're talking about high blood pressure. And high blood pressure is really a terrible disease because you don't feel it. You're not aware of it. But you can test yourself. You can go to any pharmacy, any big store will have a gadget with which you can measure your blood pressure in your wrist, in your arm, in your finger, anywhere. You can go to a mall and many times they have people that will take your blood pressure. I have seen machines in the malls where you slide your arm and you put certain amount of money and it will check your blood pressure. There are many ways, but you have to make sure your blood pressure is normal. What's normal? 120 over 80. Any number different from that, go to the doctor. Start doing something about it. Better yet, start today doing something about it. And I'm going to give you advices of what you can do beginning today. But the first thing you have to do is make sure that you're normal. Make sure that you don't have high blood pressure. And by taking the measurement once doesn't tell you anything. Because today you could be normal, tomorrow you could be hypertensive because it can make spikes up and down. So don't trust just one reading. So I would advise you to go to any pharmacy, get one of these gadgets, learn how to do it. It's very simple. Anyone can do it. And check your blood pressure and check your spouse, check your children, check your parents, check your grandparents, check everybody out. And tell people at work and tell people at church, if you want to do something good, the following religious service, bring one of these machines and start taking people and tell them where you bought it and tell them where you can buy it. You're going to be helping a lot of people. Stay with me. I really need you to stay with me because this is all too important information. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and I'm coming to you through Truth Be Told Radio Network. I'm available and ready to answer any question you have if you contact me through the social media of your choice, Instagram, Twitter, Facebook, you name it, whichever you use, I'm going to be there. Dr. Rodrigo Rodriguez, BioCare Hospital. And you can listen to this broadcast if you search Spotify, Truth Be Told Radio Network. You can listen to me direct every Friday night at 7 p.m. Eastern Standard Time, and we rerun on Saturday mornings, 9:30 Eastern Standard Time. That's in the mornings, a.m. We're talking about high blood pressure. But we're talking about how the process of BioCare Hospital brought us from number one, treating disease, treating people, as any hospital would do, then to implement a lot of things for cleansing, detoxification, good nutrition, supplementation, targeted supplementation of trace minerals, etc. And doing all these things, oxidative therapies, hyperbaric oxygen, and trying to do all these things that we thought were very important to help people to heal back. Anti-inflammatory strategies are one of the basic things that we do. But you know what? You don't even have to think of that. You don't have to think of that because when you eat right, a good diet is naturally anti-inflammatory. A good dietary plan is going to make your body alkaline. You don't have to take anything. Your body tends to go alkaline when it's fed what it should be fed, not what you just think of. When you stay away from sugars, when you stay away from industrial oils, like all the vegetables oils, but you can use natural oils like lard or olive oil, real butter. Okay, particularly butter, you have to make sure that you're getting from grass-fed animals, not the other type. Because right now with milk, we have made so many sins that I cannot begin to tell you. So, without discussing too much, you have to look for grass-fed, free animals. And that's what you want, because that's what's going to provide you the kind of milk and milk derivatives you want to bring to your table. So by doing all that, then we discover that, yes, this can produce prevention. You can stay away from problems even before they begin. And the Center for Disease Control tell us that 40% of deadly diseases that we see today can be prevented by proper lifestyle, food, and exercise programs. So all this is simple. Now, let me tell you what happens with high blood pressure. Blood pressure, of course, has to keep a certain value. Remember that life is in the blood. So you need the blood to go to every single tiny corner of the body. There's not one part of your body that can go without blood. Not one. Because if one cell doesn't get blood, it's going to die. Simple. So if you want to keep alive every part of your body, your little finger, your toe, your gut, your hair follicles, your brain, your anything needs blood. Because blood is going to deliver oxygen. And oxygen is used to produce energy. Same as glucose, which is the form of sugar. Don't confuse that with the refined sugar. The kind of sugar that the body uses as a fuel. And that keeps our bodies warm and functioning, etc. And that brings amino acids to produce protein, and that brings fats that are part of our cell structure and part of our antibody vitamin systems, etc. So there's not one little thing that you do not need, and everything is there. And at the same time, the blood is going to pick up all the debris and bring it back to the kidneys to be eliminated, back to the lungs to eliminate the carbon dioxide and pick up oxygen, etc. So to do that, the body needs to pump that blood to every part of the body. And pumping that blood is what produces the blood pressure that the blood needs to flow. Every time the heart contracts, it pushes the blood to the circulatory system. And then as it pumps, then you send a wave of blood to every part of your body. Then the heart relaxes and stays quiet for twice as much as the time it was pumping. So it pumps, relaxes, pumps again, relaxes. I'm telling you this because I'm going to tell you why is it so important. So when you pump the blood, every single blood vessel, every single organ of your body gets that surge of energy that the blood flowing is going to produce. And actually, when you have high blood pressure, you can feel it. Sometimes you can hear it. I don't know if it happened to you, but sometimes you're on your side, on the pillow, and all of a sudden you hear the pump, pump, pump. Because it is an important surge. It allows the blood to flow to every corner of the body. But then when the blood is not pumping, when the heart is relaxing, the blood pressure tends to go down until the next contraction of the heart. So when it goes down to a certain level. That level is given by the quality of your blood vessels, and it lasts twice as long as the contraction. That's why the doctors many times will tell you that you can afford a little raise in your higher reading of the blood pressure, but we don't like when your lower reading goes up, because that affects you twice as much. Because that lower reading will stay in your body for twice as long as the beating of the heart. So all this is very important. What can we do? What manages blood pressure? Blood pressure is managed by three factors. One, the pump, your heart. Second, the quality of your blood vessels. They should have to be pliable, supple. They have to be soft. They they need good quality food to create good quality blood vessels. If you eat fried food and sugars, you're going to harden them. And then is when you get arteriosclerosis, which is the technical word for hardening of the blood vessels. But it's because of your bad habits. And the last one is the density of the blood. The density of the fluid is very important. And that again, if you eat fried food and sugars and refined flour, the blood thickens and the blood pressure will go up. But if you eat your veggies and lots of water and exercise and detoxify, then that blood is going to be not as dense, and it's going to circulate a lot better. So you see, there's not anything magic. If we eat right, if we take good care of our bodies, a lot of good things happen. If we don't, a lot of bad things are going to happen. And there comes physical activity. Physical activity is very important because what you need is to keep the blood flowing all the time, but you need the blood vessels moving and you need the muscles relaxing. It is like magic. You know, when we move, when we walk, when we do things, our muscles relax. That's why we can sleep better. Have you noticed it? You do exercise, you're very tired, whatever, but you go back to bed and you can sleep. Sometimes we do nothing all the day. We sit at the office, we're working, then we go home. So we sit at the couch, we watch TV, we do nothing. Then we go to bed and we cannot go to sleep. We have cramps, we feel uptight, we don't feel good because the muscles overcontract when we do nothing. We need to be moving. We were created for movement. And if you think you can walk your blood pressure, your high blood pressure away, yes, you can. If you start walking, if you start moving, if you start doing physical activity, that's going to contribute with 10, 15 or more millimeters of mercury in blood pressure. If you have 1 ounce of olive oil a day, 1 ounce, a shot of olive oil, get good quality extra virgin olive oil, put it in a thing. You can put lemon, you can put whatever, or you can put it in a piece of bread and have it with balsamic vinegar. Have it, you pour it on a little bit of salad. Make your choice, but you have to eat 1 ounce of olive oil a day. That's been proven by places like in Spain. Doctors have proven that by having 1 ounce of olive oil a day can go a long way. And I'm going to give you another thing. This is a book that I have been reading, and I have read it for years. It's written by Dr. David LaRose, and I'm going to give you all the information on how you can get it. You have to read it because it's going to give you a lot of the why this works and why it's so good. But let me remind you again, if you check your blood pressure, and even if you're normal, you start doing things to be healthier, to prevent it, or if you have high blood pressure, you start doing things to be better, you're going to be preventing cancer, diabetes, helping every single inflammatory disease. That's how important all this is. Stay with me. We still have a little bit more to talk about. Well, what about it? I have had a lot of fun talking with you. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I want to take this time to thank you. Thank you for granting me the privilege of getting to your lives, getting to your cars, getting to your living rooms, and being able to talk to you. And in return, I can offer you that any question you have, any comment you have, I welcome your questions. So you can go to the platform of your choice, Twitter, Instagram, Facebook, you name it, and you can ask a question. I'll be very happy to try to help you. Want to give me a call, be my guest, call me, and I will be happy to talk to you and hopefully inspire you first, and second, guide you to a better lifestyle. We see so many chronic degenerative diseases today, and we see them in younger and younger people. That's probably one of the things that gets to my heart. I studied medicine over 50 years ago, and I remember a lot of problems that were basically older people's problem. But today I see them in people in their 40s or 50s. Well, somebody says that 50 is the new 40s. Well, why do you have a chronic degenerative disease? Why do you have to go to the doctor every so often? Why do you have to go to the pharmacy and the laboratory? Why do you have to spend your money in drugs that you don't need, or you might not need if you did a little bit of homework? That's what I'm talking about. I was telling you that when people tell me a very common excuse, doctor, I cannot eat better because I don't have time to cook. That's one side of the problem. Let me give you the other one. I was listening to a doctor in Switzerland that has a beautiful clinic. Very expensive, but beautiful. First class, luxury place. And he was being interviewed about how people went there just to get rid of some pounds, just to do a little bit of dental work, just to do this and that, to look better, feel better. There's nothing wrong with that. And he said, because I am convinced that the ultimate luxury is to have time for yourself. How's that? I love the phrase because it's absolutely true. The more I talk to patients, the most common excuse I get, I don't have the time. I don't have the time to do a little bit of walking. I don't have the time to cook a little bit of food. I don't have the time to go grocery shopping and be selective. I don't have the time to take my supplements. I don't have... You say, well, what kind of life are you leading? I mean, getting up in the morning, drink a shake that you already bought in a supermarket or in a convenience store, and you just peel off the thing, drink it, and go to work and run all day and bring something to your desk, which is probably fried food and fast food, and then go home and then you eat again. You have a TV dinner or frozen food, or you order food which is not going to be very good. Is that your life? Is it really that way, the way you're living your life? Be ready. Make sure you get a very good medical insurance because you're going to need it. But the problem is not even economical. The problem is performance. Do you really want to get sick at 50s or 60s and start going to the doctor every month to check your sugar level, to check your blood pressure, to check your heart disease? You really want to do this? You want to have a stroke? That's not the way you want to live. The way you want to live is grow older, retire, and enjoy your retirement. And the only way you're going to do it, make no mistake, is if we decide to take one part of our day, one part of our income to make sure we do things right. The biggest luxury of them all is to have time and money to take care of your body, to take care of yourself, because that's going to produce a lot of money. Because if you're healthy, you're going to work happier, better, longer. And if you don't, you're going to be sick, you're going to be going to the doctor, you're not going to be able to perform, you're going to be tired, and then there's going to be a time where you have a stroke or things like that. I tell people when I talk about BioCare, about the health getaway at BioCare, which is, why don't you take 10 days, 2 weeks out of your life and come to BioCare Hospital and use 2 weeks for yourself and do cleansing, detox, replenish your intestinal flora, get rid of inflammation, start losing some weight, kickstart a good nutritional program. You're going to see, people rave about our kitchen. Why? Because we look at each and every plate to make sure you're having very good food, very palatable, which will not exceed certain amount of calories and which will not contain certain type of chemicals. We make sure you're going to eat right and you're going to love the food. You're going to have your fun. Talking about comfort food, we do beautiful creations with our kitchen. Our kitchen is 7 times the size of the pharmacy. We have an in-house bread maker. We have an in-house salad maker. We take care of all these things. We shop every day, every single day for fresh, high-quality foods. That's what you get when you do a 10-day, 2-week health getaway. And then we work on a lot of things, not only cleansing, chelation therapy to cleanse the blood vessels. We check your blood pressure. We look at the origins of all these problems. We detect performance of different systems, like the immune system, like your vitamin supply, your everything, because we want to target those areas to get you better. That's what you're going to be doing. You're going to be working for those 2 weeks, 10 days on yourself, and you're going to go for dental analysis. The mouth is the origin of a lot of things. Again, you need cleansing, you need fixing little things. And many times it's very simple, and you have the time to do it. We even work on your skin. We're going to do facial and all these things because the skin ages as we age. And we're going to tell you why you might be aging faster than what you should and what you have to do. But let me tell you, again, creams and lotions will not do everything. You need to work from within. And when you cleanse your body, when you hyperoxygenate your body, like with hyperbaric oxygen, ozone therapy, different types like this, you're going to come out feeling better, fresher, looking better. I have had patients that went home and somebody in the family said, "Tell me the truth, you really went for cosmetic treatment." Because they look fantastic. Because health is beautiful. Not only that, but you're going to feel better. You're going to function better. And you know what? You are pushing away the possibility of chronic inflammatory diseases. You're going to learn on how to take your blood pressure, how to check your sugar level, how to keep a chart for your weight, how to make sure which foods are for you and which foods are not for you, and so on. You're going to learn how to BioCare yourself. And you're going to kickstart all of this. I tell you, a good diet, a system of rest and good physical activity, and all these things combined can really produce very good results. Please think of it. Think of, I have to stop at some place. I have to rethink some time. Where am I doing? What I have done so far, what I have accomplished so far, but what I want to do in the future. And many times we know our weaknesses, because many times we know that our grandfather died of a heart attack and my father had similar problem. So what am I waiting for? I have to check it out. I know somebody in the family is diabetic. A good hint is overweight. I'm not talking about looks or cosmetics. The thing is that overweight tells a story. We start gaining weight when we start doing things wrong. And we all know it. I'm not telling you anything new. We all know when we start gaining weight that we should be changing things. But there again, it's a very nonchalant, ambivalent situation where we say, yeah, but I feel good. I don't have any symptoms. Why should I change? Because you want to be the same way without any problems, without any health issues for the next 10, 20 years in the future. Actually, I tell people, you give me 10 days of your life with a good intensive BioCare program at BioCare Hospital, and I'm going to give you 10 years of well-being, of healthy living. How's that? You give me 10 days, I'll give you back 10 years. Because if you start making those changes, you are going to be profiting. You're going to be harvesting all the benefits that you can get from it. And you know I'm telling you the truth. You know it because deep in our hearts, we all know what we should be doing. Be obedient. Listen to your body. Care for your body. God gave it to you. I'll see you next Friday.